Public Health, the Population Health Approach, Chapter 1 for Community Health. All right, so in this chapter, we'll explore how public health impacts our daily lives in various ways. This includes everything from the food we eat, the water we drink, to the cars we drive. Public health even shapes things like the air quality we breathe or how we sleep. So a quick example can be running along a busy highway, increasing the health risk significantly, equivalent to say smoking 2 packs of cigarettes a day. So right there, that's an example of an environmental health in action. Then we have our health interventions. Public health interventions have a wide range of applications from healthcare delivery systems to social and environmental policies. An example of this can be say a bed net to prevent malaria and safe sleeping practices such as placing an infant on their backs when they sleep to help prevent SIDS or sudden infant death syndrome. Even simple things like mattresses can play a role in preventing back pain and improving quality of life. Now, for population health, here is a broad concept that looks at the entire spectrum of health interventions. This considers things like healthcare delivery systems, public policy such as taxation, community control, and environmental health. It also uses a life cycle approach, considering different health risks at various life stages, so like childhood, adolescence, adulthood, and aging. All right, we're also going to be talking about the determinants of disease, or the range of factors that contribute to the disease. So these include biological, social, environmental, and behavioral determinants. An example of this can be genetics and lifestyle choices, such as diet and exercise playing a role, as well as social factors like access to healthcare and education. Then we have our leading indicators, which are your early signs or measures that help predict health outcomes. For Healthy People 2030, these indicators track progress towards national health goals and objectives, so such as rates of obesity and physical activity levels, are leading indicators that predict future health trends like heart disease or diabetes. Then we have our social determinants of health. From Healthy People 2030, they define the social determinants of health as the conditions in which people are born, grow, live, work, and age. So these are going to include your economic stability, income or employment, education access and quality, social and community context, healthcare access and quality, and neighborhood and built environments. Then you also have your population changes in health. That's one thing to note, populations change over time, and these changes can have a big impact on your health. So example is as the population ages, we may see an increase in chronic diseases like arthritis and dementia. Population migration patterns also affect the health needs as well, since immigrant populations could also be facing different health risks. Okay, so when we're talking about public health, what do we mean? So when people think of public health, some might think it's as simple as washing your hands. While that is true, it is an important policy response based on risk assessment. It's only the tip of the iceberg. Other interventions include things like food and drug safety, controlling air pollution, disaster response, and detecting contaminants in the water supply. Then another common thought is that public health is about providing services to vulnerable populations, so like reducing exposure to lead or providing food supplements. While this is correct, it's still only part of the picture. Now, historically, protecting vulnerable populations has always been a cornerstone of public health. But modern public health also includes broader policies and interventions. If you go by the 20th century's definition of public health, it's defined as the science and art of preventing disease, prolonging life, and promoting health through organized community efforts. Now, if we go to the modern definition, public health is understood as population health, which involves coordinated efforts between healthcare systems, policy, and traditional public health or health education. So in summary, modern public health is organized and holistic efforts to improve policy, education, and access, making it easier for everyone to make the healthiest choices. Now, of course, public health includes addressing environmental, social, and economic factors that affect your health as well. So an example can be of universal health care, may require more taxes or cutting waste, But taxing the wealthy can create economic instability, leading to reduced investment in health. Here, middle class individuals may reduce their commitment to health if they feel their resources are being taken away. So, this highlights the complexity of balancing health policies with economic stability. Kind of playing on this on the universal healthcare example, if taxes are increased on the wealthiest individuals, make up 1% of the population, they may move their businesses and investments, making the lower classes financially less stable. Here, this creates a reactive system where the population waits for healthcare interventions instead of proactively managing their health. So ultimately, you can think of public health as everything we do together as a population in order to promote and preserve health and prevent disease, disability, and death. So a more real-world example, say in Harvard, investing in our water supply is a public health measure. All right, so for this next little bit, I'll be showing you Table 1.1, which is going to show you outlines of certain public health eras and their defining elements for the next few slides. All right, so now starting off what we call the ancient cultures approach. Here, early public health was deeply tied to culture, religion, and laws. So for example, we can start off, say, with garlic, which does have natural antibacterial, antifungal, and antiviral properties. This was also thought to increase strength and stamina and ward off evil spirits. Then we have food prohibitions. Certain cultures had prohibitions against certain foods like pork, seafood, and beef, or practices like cannibalism. They are often based on health beliefs or spiritual reasoning. The next we have, say, circumcision, which is practiced in some cultures, have a reduced risk for STDs, cancer, and UTIs, and overall improved hygiene. Then there's also citrus fruits, which are often used to prevent scurvy, a disease caused by vitamin C deficiency. Now for some historical developments, one of which is we have Edward Jenner from the 1700s. He developed the smallpox vaccine after noticing that people who had contracted mild cases of cowpox from milking cows were protected. So what he did is he injected fluid from cowpox sores under the skin of others. In Latin, vacca means cow, hence the term vaccines. Now, a lot of approaches were already established before organized public health was established, but the formation of public health didn't start until the mid-1800s, when disease was linked to social inequalities. Early public health efforts focused on the vulnerable and sanitary conditions, hence the hygiene movement, and laid the foundation for epidemiology. Now, some notable figures. First, we have John Snow, who's English and probably considered the father of epidemiology. He's famous for mapping cholera outbreaks and identifying contaminated water as the main culprit, and established the importance of careful data collection and documentation of disease rates pre and post intervention. Then next up on the list, which I'm probably going to butcher his name, Ignaz Semmelweis. He's an Austrian physician, which he used similar methods to eventually institute a hand washing procedure that greatly reduced maternal mortality. All right, now next up we have our germ theory and biological revolution. Thanks to Louis Pasteur, I hope I said his name right, and his colleagues, they developed germ theory, which revolutionized public health by demonstrating how bacteria and other organisms contribute to disease. This in turn led to advancements in diagnostic testing, widespread availability of vaccines, and a better understanding of disease transmission. However, without antibiotics or effective cures, much of early public health focused on disease prevention and isolation. Now, as we fast forward to post-World War II, the discovery of penicillin, which is a group of antibiotics that kill bacterial infections like strep and UTIs by killing or stopping the growth of bacteria, this marked a significant shift in treating infections. However, the focus was still on expanding healthcare access, particularly for individuals without private healthcare. So this is where Medicare and Medicaid come in, courtesy of LBJ in 1965. These were established in the US, ensuring healthcare access for older adults and low-income individuals. This era also saw the rise of what we call randomized controlled trials, or RCTs, and the creation of the FDA, both of which were foundational to evidence-based public health. Still going further down the list, focusing now on behavioral and risk factor interventions. Public health in the mid 20th century started focusing on individual responsibility for health, with interventions aimed at behavioral change and combating risk factors for diseases. So, example of this could be coronary heart disease prevention, which is focusing on high blood pressure, cholesterol, smoking, and obesity. Efforts to prevent the spread of HIV was a major focus during the 1980s and beyond. Then early detection of diseases like breast cancer and genetic diseases through newborn screening became more widespread. Then we also have environmental health growing in importance, with efforts to ban lead-based gasoline and paint to prevent lead poisoning. The movement also worked on reducing radiation exposure to lower cancer risk. Now let's say public health for the 21st century. Here, bioterrorism and high healthcare costs have become prominent concerns. Here, the One Health concept emerged, which emphasized the connectedness of human health, animal health, and the environment. One Health focuses on climate change, antibiotic resistance, and emerging diseases as central topics. The One Health approach also addresses concerns like contaminated products, such as harmful supplements or unsafe toys for children. All right, so what do we mean by population health in this case? Here, population health is a broader concept of public health that brings together different sectors. Here, this includes collaboration between traditional public health professions, such as epidemiology and health education, healthcare delivery professionals, such as doctors and nurses, and a variety of other fields that impact health, including environmental sciences, social work, and policy development. So here, this provides us what we call like an intellectual umbrella for thinking about a wide spectrum of factors that can affect the health of individuals and populations. And the next point is the key aspect of population health is that it's evidence-based approach to analyzing the determinants of health, disease, and possible interventions. It looks at both the root causes of health problems and ways to address them, aiming to improve health across the entire life cycle, from infancy to old age. Here, interventions of population health can take in many forms. First, you have your preventative efforts, such as improving nutrition, promoting vaccination, or ensuring clean water. Then you have your curative efforts, using antibiotics to treat infections or performing surgery for cancer. Note the goal is to maintain or improve health by addressing both prevention and treatment within the community. All right, so what I have here is a little figure on what we call the full spectrum of population health. Starting off, we have our healthcare systems, which are often say thing for your direct care and treatment. And what they do is they diagnose / treating your injury or illnesses. And a real world example can be your hospitals, clinics, and doctors' offices. The next part we have the traditional public health, which is more prevention focused and community based. Here they place greater emphasis on group or population health. And some examples of these can be public health agencies, community health centers, and health departments. Then we have social policy, which addresses social determinants of health. Social policy is concerned with the way societies address social needs and inequalities. So in other words, more real-world examples can be a social security program, unemployment benefits, affordable housing initiatives, and food assistance programs. Now, population health requires us to clearly define 4 key components. First, we have the health issue. We need the specific health problems that affect the community, like obesity or access to clean water. Then is the population, the specific groups of people affected by these health issues. So we're focusing on children, elderly, or low-income groups. Then are society's shared health concerns, issues that impact the wider population like vaccination rates, air pollution, or mental health. Then are society's vulnerable groups, groups who are at a higher risk for poor health outcomes such as the poor, infants, elderly, or racial minorities. So some more easy examples, say for a poor population, they may be at a higher risk of chronic conditions due to lack of access to healthcare. Infants, they are more vulnerable to disease, malnutrition, and lack of prenatal care. Then you have the elderly that are at a higher risk for conditions like arthritis, dementia, or falls. All right, so now what are the implications of each of the four components? So first we're focused on health issues. Historically, public health has focused primarily on physical health, but now we're recognizing that mental health is equally important. For example, mental health conditions like depression and substance abuse have a major impact on death and disability within populations. The boundaries of what is considered health have expanded tremendously. Gene modification, cosmetic intervention, and even sexual performance, and there doesn't appear to be any obvious limits to its expansion, which often makes us ask the question of what is even health. The next for populations. So typically the traditional definition was defined by geography, so cities, states, or countries. Now our current definition, we think of populations as part of a global community because health issues are not confined to one place. Now with global interconnectedness, we also have global health issues such as pandemics like COVID and climate change, which affect populations worldwide. Even something like internet connectivity allows us to interact across borders, impacting social, mental, and public health. Now, say for example, this can be disasters in one country, such as wildfires in Canada. They can cause smoke in the US, affecting air quality and health. And another common example can be, say, of China's smog. So actions like cloud seeding, was basically where you shoot silver iodide into the sky to condense moisture to induce rain, ideally to clear the sky of the pollutants. This in turn can potentially pollute the air and water, leading to respiratory issues, skin irritation, and even long-term environmental impacts like ozone depletion and reproductive disorders. Further along on the implications, public health used to be primarily concerned with communicable diseases, but today the scope has broadened significantly to include a variety of health challenges. So when we're talking about communicable diseases, these are diseases that can be transmitted from one person to another or from animals to humans, which can be through direct contact, respiratory droplets, or bodily fluids. So examples of these can be bacteria, viruses, fungi, or parasites that cause these diseases. So another example of said disease is ringworm, fungal infection that spreads easily through contact. Note, communicable diseases do remain a concern with the new emerging infectious diseases. So think of COVID-19 or HIV, which continuously challenge public health efforts. So as mentioned previously of emerging infectious diseases, diseases like COVID-19 and HIV have underscored the need for constant vigilance and rapid responses to new threats. We also have climate change that actually gets into the mix. This can affect public health by influencing factors like air quality, water quality, and the spread of diseases carried by vectors, like mosquitoes. Then you also have toxic exposures from the physical environment. Exposure to toxins in the air, water, and soil, such as pollutants or hazardous chemicals, pose significant health risks, contributing to chronic conditions like respiratory diseases, cancers, and more. Then for transportation safety, accidents and injuries related to transportation, including car accidents, pedestrian accidents, and even injuries from public transport, are also a key concern. Then we also have the cost of healthcare. The rising cost of healthcare is a major societal issue, affecting access to care, health outcomes, and overall public health systems. And then we also have society's vulnerable groups. Note the concept of vulnerable populations is fluid and has evolved, and different groups have been identified over time as being higher risk for health issues. So historically, much of the 20th century focused on maternal and child health, as well as high-risk occupations such as coal miners and factory workers. Now, say for modern day high-risk occupations, this can be construction workers, healthcare workers, and agricultural workers who are exposed to physical hazards or infectious agents. Today, vulnerable groups have brought to include mother and children still, but we also have now the disabled, the frail elderly, individuals without health insurance, and immunosuppressed individuals. So examples say patients going through chemotherapy or organ transplant recipients. We also included those with genetic vulnerabilities, so inherited conditions like sickle cell anemia and cystic fibrosis, just to name some. Note the definition of vulnerable populations continues to change as public health challenges evolve and as societal factors impact health in new ways. And finally, we have the core focus of public health. Public health has always been centered on society's overall health, with a particular emphasis on vulnerable populations. And this remains a foundational aspect of the field. But over time, new concerns have emerged and evolved. In the past, the focus was primarily on physical health, but now mental health, social factors, and environmental influences are also critical to understanding population health. So, expanding vulnerable populations. As society changes, the definition of vulnerable populations does continue to expand. What was once limited to groups like mothers and children or those in higher risk occupations are now broadened to include the disabled, the elderly, and those facing genetic vulnerabilities or being immunosuppressed. Now, to adapt to the said new health challenges, public health must adapt to new health challenges such as emerging infectious diseases, climate change impacts, and the increasing focus on mental health, reflecting the ongoing evolution of the field. All right, so now for this slide, we're going to be going over a question of should we focus on everyone or vulnerable groups? So before we even get into the approaches, public health professionals are frequently faced with this critical decision, focusing on a broad society-wide health concern or prioritizing the needs of vulnerable populations. This is given us two approaches or primary strategies. So the first strategy we could think of is the high-risk approach. So here, this targets individuals with the highest probability of developing disease. The goal here is to reduce their risk and to bring it closer to the level of experience by the general population. Then the next approach we call it the improving the average approach, which I will be going over shortly. All right, so here I have two figures that's going to be going over essentially the high risk approach method. So 1.2a, or this top one, this illustrates the high risk approach in public health, which I mentioned already targets individuals who are already at higher risk of developing disease due to exposure to multiple risk factors. So this can be cigarette smoke, toxic chemicals, or high-risk sexual behaviors. Now, figure 1.2b, it shows the success of the high-risk approach in reducing disease risk. So by addressing these factors, the goal is to bring those at high risk closer to the average level of the population's health. So the high-risk strategy is based on the idea that people most likely to develop disease are concentrated in high-risk groups who share common exposures or behaviors such as cigarette smoking, toxic chemicals, and high-risk sexual behaviors. Right, so now focusing on the other approach, which we call the improving the average, this strategy focuses on the entire population rather than just high-risk groups. The goal is to reduce overall risk for everyone, improving general health outcomes across the board. So this approach assumes that everyone is at some degree of risk for disease, and risk increases with the extent of exposure to certain factors. So think of environmental pollutants, unhealthy diets, and others. So note, while both approaches have their merits, the best public health strategies often require a combination of both. In specific situations, one may be more effective, but generally a dual approach is needed for optimal health outcomes. All right, so now for this topic, we're going to be going over population's health focus on the life cycle. So why would this be an important topic? For instance of this is that the prenatal and utero environment has been known to affect the health even after birth. Going more in depth what we call the life cycle focus, population health spans from prenatal to postmortem, recognizing that health risks start before birth and can continue after death. So an example of after death could be transmission of diseases like Ebola from the recently deceased. The next part is age. Age is the single most significant factor affecting both the cause and presentation of disease. Your age impacts disease frequency and how illness manifests at different stages in life. Now, young children often face different health risks compared to older adults. Age can also be influenced not just biologically, but also socially, such as the appropriate age for work. So, say maturing more slowly before entering the workforce at later ages, school, or retirement. Then we also have the shifting age categories. Often population's definitions change over time. There's a growing category what we call the young elderly, as people age more slowly and maintain health longer, leading to new classifications and social policies. Next, we call our lifestyle approach, which this approach categorizes disease and health risks by life stage, helping to tailor interventions. Healthy People 2030 also uses this model, organizing leading indicators by life stage to target risks more effectively. All right, so now you can see this figure in the center of your screen. Here, Healthy People 2030 identifies 23 leading health indicators organized by life stage. Here, these indicators focus attention and direct funding toward factors that significantly impact major causes of death and disability. Here, the goal is to address and improve health at each stage of life by targeting the most pressing health issues. Okay, so now we have here some of the approaches available to protect and promoting health. Now, one thing to note is that a large variety of strategies have been used, are currently being used, or maybe will be used in the future to address health issues. And these can be categorized into three groups. So the three main approaches used to protect and promote health. First off, we have healthcare. These focus on one-on-one services for both sick and asymptomatic individuals. This includes screenings, behavioral counseling, and preventative medications. Then you also have traditional public health, which here takes a population-based approach, aiming to prevent disease and promote health at the community or group level. Here it's more focused on prevention and health protection for vulnerable or high-risk groups. So some key areas can include communicable disease control, food and drug safety, environmental hazards, and addressing nutritional risk factors. So one way is public policy interventions, Public policy interventions aim to improve social conditions that indirectly affect health, like housing, education, economic growth, or global trade. These policies often focus on non-health goals, such as improving equity, access to resources, and overall societal well-being. For example, improving public housing or expanding access to education and services for the poor can have long-term health benefits. While healthcare and traditional public health focus directly on health outcomes, public policy interventions have a more indirect effect but contribute significantly to improving overall health by addressing the broader social determinants of health. All right, so what factors determine the occurrence of death, disease, and disability? Here to understand the forces that influence/determine disease and the outcomes of disease, such as disability or morbidity, and death or mortality, we need to establish the contributing causes. So some examples could be HIV or smoking, which have been established as contributory causes of disability and death. So they directly produce disease, disability, and death. However, we need a better understanding of these contributory causes. For instance, what influences or determines if someone smokes or comes into contact with HIV, those are your determinants. Note there is no official list or agreed upon definition of these determinants of disease. Now, to understand what drives disease, disability, and death, we first need to look at the contributory causes. These are the immediate causes of disease, the factors that lead to illness, disability, and death. So back to HIV and smoking, they are contributory causes. They have been clearly established as directly leading to disease and death. However, just identifying the contributory causes isn't enough. We need to ask, what factors influence whether someone smokes or comes into contact with HIV? So these underlying factors are your determinants. essentially the cause of the cause that ultimately lead to disease. Your determinants help explain why certain people are more likely to be exposed or to engage in behaviors that put them at risk. This can include a range of factors like socioeconomic status, environment, education, and access to healthcare. There isn't a universally agreed upon list of disease determinants, but understanding them is essential in addressing the root causes of health issues and developing effective interventions. So for focusing on the determinants, a useful acronym is called Big GEMS. So starting off this acronym, for B, we have behavior. Behavior refers to actions that can either increase or decrease the likelihood of developing disease. Common examples include smoking, lack of exercise, poor diet, unprotected sex, and alcohol consumption. It's essential to note that some behaviors can reduce the risk of disease as well, as I mentioned previously, so such as regular physical activity or a balanced diet. The next you have I for infection. Infections are your direct causes of disease. We both know that early and long-term exposure to certain infections can influence disease development. Interestingly, early exposure to some infections may even help the body develop immunity, reducing the risk of disease later on. So such as the idea of chickenpox, it's better to get it when you're younger. Then G, we have genetics. Genetics play a significant role in disease development, influencing how individuals respond to diseases and treatments. For example, two smokers may develop lung cancer at different ages based on their genetic makeup. However, genetics is rarely the most important determinant of disease. Lifestyle factors, like exercise and diet, or not smoking at all, often play a more critical role in long-term health. Then for our next G, geography. Here, geography influences the frequency and distribution of diseases. Certain conditions like malaria and Lyme disease only occur in specific regions. Disease risk can also be tied to elevation, such as altitude sickness, or temperature, such as frostbite under the cold conditions, or heat-related illnesses in a hot climate, excuse me. Additionally, regions have different risks based on local wildlife, such as the type of snake bites in certain areas. So say above 6,000 feet, poisonous snakes are rare. Then for our next E, environment. Never mind, first E, we have environment. Here, the environment encompasses both natural and built factors. Excuse me. So starting off for your natural environment, this will also include your natural disasters, such as earthquakes and hurricanes, and we also have nutrient deficiencies in certain regions, such as iodine deficiency in soils. Built environment, this is focusing on your human-made environments, so indoor air pollution, presence of infant-proofed homes, and traffic hazards. These can also influence your health outcomes as well. Then for our M, we have medical care. So access to quality medical care is obviously a crucial determinant of health. Preventative care such as vaccinations can protect non-vaccinated individuals, especially when a high percentage of the population is vaccinated. Timely treatment for infectious diseases can limit their spread, and behavioral health counseling can help individuals adopt healthier habits and quit harmful behaviors. Then for our S, we have socioeconomic or cultural. Here, socioeconomic factors such as education, income, and occupation are strongly linked to disease risk and health outcomes. For example, diseases like tuberculosis, breast cancer, and occupational injuries tend to affect lower socioeconomic groups more frequently. Additionally, cultural and religious beliefs can also influence decisions regarding treatment, further affecting health outcomes. Here, this highlights the growing importance of addressing social determinants of health, such as improving access to parks, walking trails, healthy food, and fitness facilities in underserved communities. All right, so we're more touching on the social determinants of health. So here, your social determinants of health are conditions in the environments where people live, learn, work, play, worship, and age. Here, these conditions have a profound impact on health outcomes, functioning, and overall quality of life. So think about it this way. The social environment just goes beyond just your genetics or individual behaviors. This is going to include where you live, quality of your school system, safety of your neighborhood, availability of healthy food, your access to affordable healthcare, and many other factors. So some other examples can include your housing conditions. Are you overcrowded or exposed to toxins? Your education systems. So availability of quality education, opportunities for lifelong learning. Then there's workplace conditions, such as safety and job security, access to healthy foods. Do you have fresh produce or you're in a food desert? Then there's transportation. You have a reliable public transport or safe walking environment. Social support, family structure, community networks, and others. Access to healthcare services, health insurance, or proximity to healthcare facilities. And then there's also discrimination and social norms, so such as stigma, racism, and gender inequality, for example. One thing to remember is that these factors often interact with each other, influencing health outcomes in complex ways. For instance, individuals in neighborhoods with limited access to healthy food options may face higher rates of obesity, diabetes, and other chronic conditions. Similarly, people in lower socioeconomic groups often face barriers to accessing healthcare, leading to poorer health outcomes. By addressing your social determinants, we can have significant impact on reducing health disparities and improve overall population health. This is why policy and community-based interventions are so crucial. They help reshape the environment that can either support or hinder health. All right, so here we have the figure from Healthy People 2030, which is the framework for your social determinants of health. So now each component here is linked to a specific goal and a 10-year measurable outcome. So starting off with the goals, first we have the economic stability goal. Here's to help people earn incomes that allow health needs to be met. People with steady employment are less likely to be in poverty and more likely to be healthy, but many people struggle to hold and keep a job. Existing conditions like arthritis can limit their ability to work. However, steady incomes don't necessarily mean people can afford the things to be healthy. So things like employment programs, career counseling, and high quality childcare can help individuals get and keep jobs, pulling them up out of poverty. Our next goal is the education goal. So here's to increase educational opportunities and help children and adolescents to do well in school. Higher levels of education correlate to healthier lifestyles and longer life. Stress from social discrimination, poorly performing schools, and paying for college affects children's brain development, making it harder to do well in school, which is in turn leading to higher dropout rates, and also less opportunity to get safe, high-paying jobs, and a higher risk of a variety of health problems. Then we have the healthcare access and quality goal. Here is to increase access to comprehensive, high-quality healthcare services. 1 in 10 people in the US don't have health insurance, which means they are less likely to have a primary care physician and be able to afford healthcare services and medications they may need. Then there's the neighborhood and built environment goal. Here's to create neighborhoods and environments that promote health and safety. Here, improving the safety of places where people live, work, learn, and play can have a major impact on their health and well-being. However, many people live in neighborhoods with high rates of violence, or unsafe air or water, and minimal walking paths. So interventions like adding walk or bike lanes can help improve the quality of life. And then for the social and community context goal, you have increasing your social and community support. So all that is just the framework of the Healthy People 2030 initiative, which is to illustrate the social determinants of health, and here to provide a roadmap for addressing health disparities through measurable outcomes and goals for the next 10 years.